The next bill on the calendar for the day is House File 2403. The clerk will report the bill.
House File number 2403, number 3 on the calendar for the day, an act relating to commerce, the first engrossment.
There are amendments at the desk, but if there is no objection, we'll let the author explain the bill. I recognize the member from Stearns, Representative O'Driscoll.
Thank you, Mr. Speaker. This is the second part of the Commerce work product this session. Again, I'd like to thank the members of the committee and co-chair her, and I'd also like to again call out the nonpartisan staff who supported us in the way of Laurie Pompum and Solveig Beckel and our page, again, Natalie Weaver. And members, in the policy bill, I'm going to just summarize. We have a lot of different individual components here, but to give you a little bit of a heads up and an overview, we have some antiquated fire code that is being taken out of the state statute that's covered elsewhere. We have some technical changes from the Department of Commerce. We also have a number of provisions dealing with financing, whether it has to do with the maximum interest rate that can be charged and how that's determined on a contract for deed or a mortgage. We also have some modernization practices that deal with using electronic signature and transfer of documents. We also have some provisions dealing with various types of fuel that are sold here in the state of Minnesota. 2 members carrying provisions on that. We also have some provisions in the bill today as well dealing with auto dealers being able to conduct auto shows that might otherwise be outside of their territory, again, a non-controversial provision. We also have some paperwork in here for the appraisers who need continuing education. They can have taken that continuing education out of state or certified by another state, and the Minnesota Department of Commerce will approve that for Minnesota credit. We also have a provision in the bill that allows you, if you don't know where your policy is, you can contact your insurance company and they'll send you another electronic version or a hard copy of that. And we also have a provision in here that deals with some long-term care insurance changes, and we also have some provisions dealing with the use of water and ticketed events and how that may be made available. And we also have a repeal in here, something that was passed a few years ago, dealing with Medicare supplements to keep them more affordable. And again, Mr. Speaker, that is an overview of the bill. It's a good compromise policy bill. And again, I'd like to thank the members of the committee as well for their professionalism and working together to get to a good product here for the state of Minnesota. And ready for amendments, Mr. Speaker, when you are.
I recognize the member from Ramsey, Representative Herr.
No comment, Mr. Speaker.
Perfect. We'll move on to amendments. There's an amendment at the desk. The clerk will report the amendment.
O'Driscoll moves to amend House File number 2403. The first engrossment, the amendment is coded A11.
I recognize the member from Stearns, the author of the amendment, Representative O'Driscoll.
Thank you, Mr. Speaker and members. The A11 amendment removes a provision from the bill that some of the folks wanted another little opportunity to do some fine-tuning and some work to that, and we felt that that was appropriate. And so what the A11 amendment does is it removes that section of the bill, and I encourage a green vote on that. And just for members' information, we've got a couple of other amendments that are going to clean up the bill as well from some legislation that was passed off the floor at the time we were working on the omnibus bill that just brings the this bill into line with what's actually relevant at this point in state statute, I should say in business before the floor. So again, a green vote or a yes vote on the A11 amendment. Thank you, Mr. Speaker.
I recognize the member from Ramsey, Representative Herr.
Members, please vote green.
Seeing no further discussion, all those in favor of the amendment, please signify by saying aye. All opposed, say nay. The amendment prevails. There's an amendment at the desk. The chief clerk will report the amendment.
Herr moves to amend House File number 2403. The first engrossment as amended. The amendment is coded A13.
I recognize the member from Ramsey, Representative Herr.
Thank you, Mr. Speaker. This is an amendment to delete the provision that requires plain language for some garnishment forms. I've already spoken with Representative Ryer. This bill is moving as a standalone bill. It's already passed the Senate, and it will be heard tomorrow on the floor. So I ask for a green vote on this.
I recognize the member from Stearns, Representative O'Driscoll.
Mr. Speaker, members, I support the motion to vote yes by co-chair Herr. A green vote and a yes vote would be appropriate. Thank you.
Seeing no further discussion, all those in favor of the amendment, please signify by saying aye. All those opposed, say nay. The motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Herr moves to amend House File Number 2403, the first engrossment as amended. The amendment is coded A14.
I recognize the member from Ramsey, Representative Herr.
Mr. Speaker, this amendment deletes the Minnesota Insurance Guarantee Association, which is allowed to request financial information. This bill is also a Ryer bill that is moving as a standalone bill. It has already passed both the House and the Senate, and it is on its way to the governor to be signed. So I ask for a green vote.
I recognize the member from Stearns, Representative O'Driscoll.
Thank you, Mr. Speaker, and I support the amendment and encourage a green vote as well to remove that language from the omnibus bill.
Seeing no further discussion, all those in favor of the amendment, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Liebling moves to amend House File Number 2403, the first engrossment as amended. The amendment is coded A12.
I recognize a member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. So members, there's a lot that's agreed in this commerce policy bill, but there is a very controversial provision in it too. This commerce policy bill that's before you repeals some very important health insurance protections for your constituents who are seniors on Medicare. The A12 amendment that is before you would stop that repeal. Now, these provisions are not actually working yet because they were delayed until until I think August of 26. So they're not yet in effect. Members, this is a complex issue, and I know that many of you probably don't have the background for it. In fact, when I first was informed about this issue a couple of years ago, and we ended up passing the provision into law, I did not know much about it. But I do want to give you some background and help you understand a little bit about it, because your constituents who are seniors are watching this debate. They are watching because this issue impacts their lives and their futures. They want to know whether you side with them or with the big insurance companies. Seems like a pretty easy one to me. Big insurance companies or seniors? And I think it really is pretty clear that that is what we're talking about here. Now, Medicare, which we normally don't do a lot with here in Minnesota because it's a federal program, it is a great program. But one thing that people may not understand about Medicare is that it doesn't cover everything, and it has very high out-of-pocket costs. And unlike the insurance that most of us are used to, there are no caps on Medicare. So there's a 20% copay for outpatient coverage, and there's no cap on that. And if you go into the hospital, you pay a $1,600 deductible every time you go into the hospital, and there's no cap on that. So if you have original or traditional Medicare, and you don't have what's known as supplemental insurance, or I call it a Medigap policy, you could really be in serious trouble. So this is something many people don't understand if they don't deal with Medicare. If you're not Medicare aged, you don't have to have parents or grandparents you're helping with this, that Medicare leaves seniors with significant gaps. So this is on the one side. Now I want to point out to you, members, I'm not going to give a whole tutorial on this. I sent out to you three different documents. One of them is what I call my explainer, which was written by me, so I take responsibility if there are any errors in it, but it kind of walks through this, why this is important, and the difference between Medicare, original or traditional Medicare, and what are known as Medicare Advantage plans. And this is really important because a lot of seniors buy what's known as a Medicare Advantage plan. You may see these advertised on TV during open enrollment periods. They're heavily promoted. They are private insurance products that are heavily subsidized by the federal government, and they look on the surface like a great deal for seniors, and sometimes they are a great deal. They sometimes have low or no premiums. They sometimes offer special extra benefits that regular Medicare doesn't offer, like eye exams and dental and stuff like that. So they're very attractive to seniors. But the problem comes that when a person first goes on Medicare, they have to make a decision about which path they're going to follow. Are they going to buy regular Medicare and go that way and then buy an additional plan, a Medigap plan? And also a pharmacy plan, by the way. They have to buy that separately, too. Or are they going to get this all-inclusive Medicare Advantage plan, which is heavily promoted by the insurance industry? Why? Because they make a lot of money on these plans through the federal government. Okay, so that's the choice your senior constituents have to face. Now, the problem is that if they, under the current law, if they decide, I think it's within 6 months of becoming eligible and certain other times, they can buy this Medigap policy, even if they have pre-existing conditions, they can buy it. But if they don't choose right away to buy a Medigap policy, they may be locked out of ever being able to get one. So if a person chooses a Medicare Advantage plan, and then for some reason down the road they don't like that plan, they're stuck, or they may be stuck, because if they have any kind of pre-existing condition, now in Minnesota, they could be excluded. So for a whole list of things, certainly for something like cancer or dementia or heart disease, sorry, you're stuck on Medicare Advantage. You cannot get off because you can no longer buy a Medigap plan. And of course, not having one, if you have any serious health conditions and you go on regular Medicare, it's like being uninsured. So this is a situation. Insurance companies can refuse to sell a Medigap policy to a senior because of pre-existing conditions. This traps seniors into private insurance policies known as Medicare Advantage that may not meet their needs and that are really great for the insurance companies. The insurance companies justify being able to deny this coverage by claiming that premiums will skyrocket if they can't pick or choose their enrollees. The Commerce Department did a study of this, and this was why implementation was delayed, and they found that there would be some increase in premiums, and you've got some information before you in the sheets that I've handed out, but it is not catastrophic. And in fact, other states do this, and the sky has not fallen. The bottom has not dropped out of the Medigap insurance marketplace, and people can still buy plans at reasonable rates. But they have choice. They have choice. So when people say, oh my gosh, if we do this, if we make the insurance companies actually cover people who need the care, then this will just blow up the insurance market. Well, that's really not accurate. The evidence really does not show that. The other thing that's really important to know is there are lots of reasons that your constituents may want to leave a Medicare Advantage plan and go back to original Medicare. Lots of reasons besides getting sick. But let's start, first of all, with somebody who goes on that plan, buys a Medicare Advantage plan, the private insurance coverage, and then finds out that it doesn't suit them. Say they get a disease and they want to see a physician who's not in network. Can't do it. So those plans, those private insurance plans, have all of the difficulties that private insurance plans do generally. They have very narrow networks. They do prior authorization. So they may actually deny care to people who need care and cannot get it under that plan, and yet they are stuck. But there are other reasons that people might want to get out of a Medicare Advantage plan. And I want to remind you, and I pulled up on my computer some of what happened last fall, some of the news articles. In the Minnesota Star-Tribune, I don't know if you all remember this. This is from October of '24. And there was several articles in the Star-Tribune. Here's one of the headlines. Minnesota seniors face Medicare dilemma. Stick with doctors or health plans? So some of you may remember this. This affected thousands of seniors across the state, where there was a big fight between some of the insurance companies who sell these Medicare Advantage plans and some of the doctors and hospitals that they contract with. There was a big fight, and some of the hospitals said, we don't like what you're paying, we're not going to accept your insurance anymore, and suddenly seniors couldn't go to their doctors that they'd been seeing, couldn't go to Regions Hospital, couldn't see the doctors that they had been seeing. So suddenly, for not health reasons, but just for reasons of the insurance plan, suddenly they wanted to switch, or some of them needed to switch. Some of them might have wanted to go to original Medicare, because original Medicare doesn't have networks. You can follow your doctor. If you move, you can go to somebody in your new area, things like that. So there are lots of reasons why somebody might decide to change and go back to original Medicare that isn't about having bad health. They want to follow their doctors. They might be moving from an employer plan after retirement, when sometimes employers decide to drop the support for the Medicare Advantage plan they've been paying for, a person might want to change at that point. And these Medicare Advantage plans can also change their formulary, their drug formulary, which is something we've talked about a lot on this floor, how unfair it is when you're on a drug and suddenly the formulary gets changed out from under you. And that can also happen in these Medicare Advantage plans. So members, we should not be doing this to our seniors. We should let this program go forward so that seniors can get the plan that suits them. They shouldn't be discriminated against on the basis of pre-existing conditions. They shouldn't be told that once they make this decision, it's once and done pretty much. When you originally become eligible for Medicare, you have to make this very momentous decision, and based on what you think your needs are going to be. And if you make it wrong, if you end up moving, you need a different doctor, something like that, you could be really out of luck because of the way our law is in Minnesota right now. But we made the change. We made that change. But what this bill is doing is repealing that change. I do want to point out the letters that I put on your desk here, one from AARP and one from the Leukemia and Lymphoma Society. And I hope you will take a look at these. The one from AARP talks about the situation of 3 different seniors who found themselves in these situations. And this is something that, as I said, we don't talk about this a lot in Minnesota because usually we think, well, that's Medicare. We're not in charge of that. It's the feds. Let them worry about it. And indeed, in most of my years here, that's how I thought about it, not realizing that what we do have control of, we are failing our seniors. We are failing our seniors. And AARP has noted that they've gotten more engagement on this issue than just about any other issue with the members that they have in Minnesota. There are lots of seniors who really care about this issue. It impacts them. They don't want to be locked into a private insurance product that doesn't meet their needs. They want the freedom to be able to go back to original Medicare, buy a Medigap policy, and not be discriminated against because of pre-existing conditions. So with that, members, I am going to stop there, and I think this is a very important issue. I'm not going to speak again on this issue, but I am going to tell you that because of this issue, because I know that this amendment is not going to pass on the floor this evening, I'm just going to tell you right now that I'm voting against this bill, because I am not going to vote to repeal this program that's going to help all these seniors in Minnesota. But for now, I'm going to withdraw the amendment. Thank you, Mr. Speaker.
Representative Liebling withdraws the amendment. There are no further amendments at the desk. The chief clerk will give the bill its third reading.
Third reading, House File Number 2403, as amended.
Third reading. Further discussion to the bill. I recognize the member from Ramsey, Representative Finke.
Thank you, Mr. Chair. I got back just in time. I want to say, first of all, this is my first time on Commerce, and I want to thank both of the chairs. I learned a lot, but I have a lot to learn, is what I learned from the Commerce Committee. But I want to thank both chairs, and I want to thank CA Simon Brown especially for assisting me with my free water bill. My free water bill is in this bill. It is great because water is good and should be free. So I hope everybody will support the free water bill and vote for the bill.
I recognize a member from Olmsted, Representative Smith.
Thank you, Mr. Speaker. This is also my first time on Commerce, so I want to start out and thank both of the chairs for not just what we did in Commerce, but how we did it, how we were able to discuss things. Chair O'Driscoll, I truly do appreciate how you ran the committee and how you listened to us. And Chair Herr, of course, I'm so appreciative of your communication with us, and it was a great experience, which is why I am sad to tell the body that I will also be voting no on this particular bill. And it is because of the Medicare Supplemental Insurance Plan open enrollment repeal. Health insurance in the United States is about a $1.6 trillion industry. But that's not enough for health insurance companies in our country. They are currently fighting each other for more and more control over the healthcare decisions of every single American. They are racing not just to acquire more health insurance companies, but to acquire actual providers and pharmacies and pharmaceutical companies who develop those drugs. United Health Group is the nation's largest health insurer. It is also the largest owner of physicians' practices and owns one of the big three pharmaceutical benefit managers. That one company can, in certain cases, coordinate a patient's cancer care to make sure that they see only their providers. They can get drugs negotiated via a deal with their own pharmacy benefit manager and then ultimately dispense those drugs through their own pharmacy. Every step of the way by one company that is making profits at every single one of those stops. These companies, when they're in Wall Street, the reports they make there are telling us again and again, those reports are great. They're making profit. CEO pay is soaring. They're asking for more investment to expand their footprints. And yet when they come to us, the people who represent the people who need health care, they tell us that they're in trouble. That if we don't grant them more control, this industry will spiral. They won't be able to offer a product that people can afford. They say Minnesotans on Medicare need to have less choices. Thankfully, in 2023, we were able to make a small victory with this open enrollment period, so that when those who are on Medicare find out that whatever plan they chose, for whatever reason, is not working for them. There's a lot of reasons that that could be. They want to stay with their doctor and their doctor changed insurance coverages, or they have a new diagnosis, or a certain injection is not covered in the same way they thought it was going to be covered, or a certain medication. We said you can have it, in 2023, this body said you can have a choice. When an open enrollment period comes out, you can enroll in these certain kind of plans that you might like better than what you're doing currently. So it's a small thing, but it's an important thing for those people who find themselves in those situations. And now, the insurance companies are telling us that is too much choice for people who are on Medicare. We can't provide the care for those folks in this particular way without skyrocketing the cost for these plans. So we can't do that. We have to stop listening to the companies who are profiting off of healthcare emergencies and insurances. We have to listen to the people who are getting the care, who need the care, who want the care. I am voting no on this bill because I think one small step in that direction is to allow for this open enrollment period. But outside of even this particular bill, I'm imploring all of us in here. The health insurance industry in our country is not working. And continuing to listen to these companies and doing what they ask us to do is not going to fix the problem.
I recognize the member from Ramsey, Representative Lee Kay.
Thank you, Chair. So I will be voting for this bill, but I did want to just share a couple of remarks with folks, and I want to thank Co-Chair Her for allowing me to talk a little bit about my bill to create a fraud restitution fund for Minnesotans who have been scammed, and that's House File 1392 if you want to add yourselves on now. While House File 1392 is not currently in the bill, I do hope that its language will eventually be adopted because it's a bipartisan proposal in this chamber as well as the Senate. And this makes sense if we want to combat the proliferation of financial scams that has come with the explosion of the internet. Last year, it's estimated that Minnesotans lost more than $120 million to unscrupulous criminals through various frauds and scams. And we know that's on the low end because many people who are tricked into scams often don't report their losses because of shame and a variety of other things, right? But if I were a betting person, I'd wager that every single one of us here knows someone who has been scammed or has actually been reached out by fraudsters online. I know I have. Something that many folks have figured out is many of these people do not reside in the United States, and so that limits any recourse that can be taken. And that's where House File 1392 would provide some peace of mind to folks who have been victims of fraud by creating this restitution account or a special revenue fund to compensate consumers directly impacted by these unlawful acts. So while the many innovations that have come in this digital age have also been weaponized against Minnesotans, this is a small but impactful solution for the problem, and I hope that it'll be considered as we move into conference. Thanks.
Recognize the member from Dakota, Representative Ryer.
Thank you, Mr. Speaker. While I've carried commerce bills in past sessions, this is also my first term serving on the committee. And I'm glad I'm on it. It's an excellent committee. It's hardworking, collaborative, and focused on getting details right. My thanks to Chair Her, Chair O'Driscoll for your leadership, to my fellow members on both sides of the aisle, and to staff, partisan and nonpartisan. The Commerce Policy Bill is not glamorous. However, much of the bill and the committee's work overall provides an example of good governance. As a legislature, it's our responsibility to make things work better so that Minnesotans can flourish. Some of the issues we've addressed may seem small, but solving these problems really makes a difference for the people who are affected. This is also true for the Commerce Finance and the standalone commerce bills. They help consumers, and they also help businesses which depend on predictability to run their companies. Contrast our committee's careful approach to the rampantly chaotic approach we've seen in the Trump administration's first 100 days. Tariffs on, tariffs off, seesaws on Wall Street, indiscriminate staff cuts, and unelected billionaires
Mr. Speaker?
Brandishing chainsaws.
Is this a point of order?
Yes. What issue are we on right now?
We're currently on third reading, House File 2403, Representative Ryer.
and plundering through personal data, making us all less secure in the process. Also look at the demonization, the hate, and the othering that infects the Trump sphere. Minnesotans hate that, and I'm proud that our commerce team worked together and that we were able to work through our disagreements while usually not being disagreeable. This commerce policy bill is not perfect. In particular, I'm concerned about the repeal of the Medigap open enrollment period. This is a top concern for my constituents, and I want you to know that I have heard you. It also runs counter to my personal value that we must make healthcare more accessible, not less. I strongly hope we'll fix this in conference committee, and today, with this hope, I will be voting to support the bill to move it along to conference. Thank you, Mr. Speaker.
I recognize the member from Ramsey, Representative Herr.
Members, thank you for the conversation today. As the author, as a co-chair of this committee, I will be voting yes for this bill, and I would encourage others to do so. But I also understand that there is a provision in this bill that might be difficult for some, and that I will ask that you vote your conscience. I understand that we all have different districts, and we represent different makeups of people. So again, I encourage you to vote your conscience. Understand that this is the beginning of the process, not the end of the process, and that we still have negotiations and something final that we will be bringing to all of you. Representative O'Driscoll and I are both individuals who really care about this bill, and we want to make sure that we bring back bills that everyone can vote for, and that I have much hope that we'll still be able to do that. So I will be voting green, but I do ask that you all vote your own conscience. Thank you.
I recognize the author of the bill, the representative from Stearns, Representative O'Driscoll.
Thank you, members. Thank you, Mr. Speaker. Please vote yes.
Seeing no further discussion, the clerk will take the roll. Members, please vote.
Go ahead.
Perez Vega, yes.
Sorry.
The clerk will call the name of the members voting remotely.
Hussein.
Aye.
One more time.
Hussein, aye.
Hussein votes aye. McDonald.
McDonald, aye.
McDonald votes aye. Perez Vega.
Go ahead.
Perez Vega, yes.
Perez Vega votes aye.
The clerk will close the roll. There being 112 yeas and 19 nays, the bill is passed as amended and its title agreed to.